Prevention and imaging to navigate your key risk factors is the focus for Ascension Saint Thomas's program known as PINK. Today, breast surgery specialist Dr. Lisa Bellin talks to us about this program, early breast cancer detection, and more. But first, let's get a check of the headlines. The 2026-27 free application for federal student aid is now open for all Tennessee students, meaning you can apply now. From October through April 1st, 2026, schools and community organizations across Tennessee will host a Tennessee FAFSA Frenzy completion events, providing hands-on assistance to students and parents. The Tennessee Public Charter School Commission has now overturned two Rutherford County School Board decisions that had denied Rocket Ship Charter School's application. Rocket Ship Charter School can now move forward with its plans to open in Rutherford County for the 2026-27 school year. The public charter school operator runs 3 elementary schools in Nashville. This is the 4th charter school in Rutherford County. In case you missed it, Buc-ee's broke ground on its first supersized travel center in Middle Tennessee at Joe B. Jackson Parkway and I-24 in Murfreesboro. The almost 1-mile stretch includes a 3-lane curb and gutter section with a sidewalk on each side. It is part of the city's 2040 major transportation plan.
He shoots and he scores!
Welcome back. I have the pleasure of sitting down with Lisa Bellin, Dr. Lisa Bellin. She is a breast surgeon here at Ascension Saint Thomas West. First off, thanks for your time.
Pleasure.
This month being Breast Cancer Awareness Month, we're in 2025. What has changed over the years and how should we address the topic of breast cancer now?
So breast cancer care has changed dramatically over the years. Since I finished my training over 20 years ago, the drugs we use, some of the surgical approaches we do, the imaging we have, a lot of it has changed. I think that there's a lot of money that gets infused in breast cancer research and breast cancer awareness, of course, and that has kept breast cancer on the forefront of trials and tweaking and trying to optimize cancer care. What we do optimize in patients is individualize approaches to cancer care, because cancer is a very broad word. Breast cancer is a very broad word, and I tell my patients it's like the word mammal, whereas if you're in the room with a little mouse versus a tiger, those are two very different mammals. And some breast cancers are like a little mouse, and some breast cancers are like a tiger. And so our job is to sort through which one is for which patient, and then how to individualize their care and optimize their outcomes.
When it comes to age, again, back in the day it was start your mammograms at 45. This day and age it is the age of 40. That being said, we're seeing a number of younger women finding out or having signs of breast cancer. Should we start earlier, or is that a big conversation for you guys?
It is a conversation for us. I mean, we are not the front line of the conversation. The front line of the conversation is with the patient and her OBGYN or her internal medicine provider. We are the ones who then see the patients for the problems. But that being said, the American College of Radiology, American Society of Breast Surgeons, American Cancer Society, we are all on the same page of screening mammograms for an average risk patient to start at 40. But the key words there is an average risk patient.
Okay. What about a higher risk patient if there's something in their family history?
So a higher risk patient should have a conversation with their provider, with their primary care provider, and see if they're high risk. And in a high risk patient, getting a mammogram earlier than 40 definitely might be a possibility. Adding MRIs, genetic testing, and then some prevention modalities may also be in their realm. And so we at Ascension Saint Thomas, we have a high-risk clinic called PINK, which actually is an acronym standing for Prevention and imaging to navigate your key risk factors for breast cancer awareness. And so we calculate a patient's risk based on what's called the Tower-Cusick scale, and that incorporates many different factors. But basically, if a woman is deemed over 20% lifetime risk, that's considered high risk.
Okay.
The average risk for women in this country is 12%. So if your risk is over 20%, adding MRIs or considering MRIs, depending on the family situation, starting anywhere between 25 and 30 might be a consideration,
okay,
and mammograms as early as 30.
Why did you get into this field? What was it about this field that attracted you?
So, great question. So after medical school, and of course I did 6 years of surgical training, and then I narrowed my focus down to breast cancer. I think because of the continuity of care. I mean, I do love operating. That's why surgeons become surgeons, frankly. That's what we like to do. The immediacy of the benefit that we do in the operating room is it's almost magical that we get to do that. In breast cancer, I kind of found a niche that I know I help. First of all, I help the majority of patients that I take care of, meaning probably 85% or more are going to be okay from their disease, which is very satisfying.
Is there anything I have not asked you that you would like to share? Make sure that people know.
I think what's important, and we touched a little bit on younger women with breast cancer, and so if you're not someone with a family history and you're under 40 and you notice a change to your breast, there are tons of changes that happen to our breasts when we're premenopausal. Our breasts change every month with a cycle, or you're pregnant and you've had breast changes. But if you've noticed something that's different for you, or it's different from the other side, don't wait on it. Bring it to the attention of your doctor, of your GYN, of your primary care physician, because to me it's heartbreaking when I see a younger woman with a more advanced cancer who said, yes, well, I did notice these changes about 4 or 5 months ago, but I didn't think it's anything because I don't have a family history, or, I'm not real sure what it is, so I didn't really do anything about it.
How often should we be doing our self-breast exams?
I tell people, do them just weekly.
Really?
Because if you do them once a month, I feel it's really hard to remember, oh my God, was it that time? When did I do it? Okay. First of all, it's best to do a breast exam post-period, like right after your period. But if you're making this big announcement to the family, like, hello everyone, I'm going to do the breast exam now, it really feels weird.
Right.
But if you're naked and touching yourself anyway in the shower, do it every Saturday.
Okay.
I don't know, pick a day.
Well, I have to ask, for those of us who may have had a hysterectomy due to one reason or the other, what about for those women?
Same
thing.
Do it every Saturday. I don't know, pick a day. Pick your favorite day of the week.
I have no idea.
It's
And I'm trying to think, the
easier.
last time I did that was, I can't tell you when.
Do it tomorrow.
I'm going to now. Thank you, Dr. Lisa Bellin. We appreciate your time. We appreciate what you do,
My
and just
pleasure.
kind of the gift that you give to women that you work on. So
Well, thank you for giving us a mechanism to chat about it and talk and share it with people.
My pleasure. If we wanted more information, or if we have questions, where should we turn? Our primary care doctor, of course, but is there a website? I mean, if we're at home and we're just, I don't know, you don't want to get lost down the,
Don't go down the trenches.
Don't go down that way.
Don't go down the trenches. So breastcancer.org is a very good website with very valid information. That's probably one of my favorites. Very, very patient friendly.
Okay, good to know. Thank you, Dr. Lisa Bellin. Thank you so very much.
Thank you so much.
St. Thomas West. We appreciate your time. We do have an app that can walk you through self-breast exams. We're going to share that with you when we come back.
Busy bee, yeah, busy bee. If you need
Hold on, y'all. Hold on. I need to make a call. Hey, this is Brianna with Busy Bee. I'm giving you a call to let you know your technician is on his way.
3-3.
Guys, not yet. Not yet.
Busy bee, oh,
I'm
busy
ready,
bee.
guys.
Call 775-7833.
Welcome back. Check out Feel for Your Life, an advocacy platform for better breast health. The app helps users set self-breast exam reminders and tracks your progress. The app's creator, Jessica Balladad, is a breast cancer survivor and now a passionate advocate. Thanks for joining us. We'll see you back here later on.